Hello, welcome to my live from Centred Mums Pilates. So I am going to do some pregnancy work with you today. So congratulations if you're pregnant and joining me. It's going to be lovely to have you today. And one thing that I want to talk about is that we're going to do a lot of movement, but I'm going to kind of try and give you a little bit of movement education and education about how your body works during pregnancy and what maybe your priorities need to be in terms of exercise. So as we go through, we're just going to have a little chat about all of those things. So we're going to start on your mat or wherever you are and come into a calf stretch. So I want you to think about your alignment here. Make sure that your hips are square and that your knee lines up with your middle toe. So often when you're pregnant, your glute muscles might want to switch off a little bit because there's so many big changes happening in your pelvis, and you might find that your knee starts to roll in. So I want you to think of trying to spiral that thigh bone outwards a little bit, which will just gently switch on your bum muscles. And that's a really useful way to think of things, is that if you can get yourself into good alignment, then the right muscles will just switch on, and you don't need to think about squeezing things and activating loads of things. If you get yourself into a good place, then everything just happens without you thinking about it. So you've got both feet pointing directly forwards. Your rib cage is stacked directly over your pelvis, and I'll come back to that in a second. And then you're going to reach over into a little side bend and really send your breath into the back and the side of your rib cage, and then come back to the centre and think of a lovely long spine as you reach over the other way. So send your breath into the back and the side of your ribs as much as you can, and then come back to centre. And just to be conscious that if you've got any pain around your pelvis, so obviously you're only exercising if you've been given permission to do so, or that your doctor hasn't told you not to exercise. So come into another calf stretch on the other side. But if you've got any pubic bone pain and any discomfort around your pelvis, you might want to make this movement a little bit smaller and step your feet in a little bit. Don't do anything that makes your pubic bone hurt throughout the session, so just be conscious of that if you've got anything like that going on. So again here, thinking about your alignment, your knee stacks over your middle toe. You're also going to think about where your rib cage is in relation to your pelvis. So when you're pregnant, obviously your bump is growing like this, and what we don't want to happen is for you to kind of throw your weight back and to put too much pressure into your abdominals. So you want to think of a lovely sense of length through your lower back here. And as you find that length, again, think of that outward spiral of the thigh bone. Feel a little bit of a lift moving through the arch of your foot. And then gently reach over into a side bend. Send your breath into your rib cage here. And then lengthen through the centre and reach over the other way. And again, use your breath, send your breath into the back and the side of the ribs as much as you can. It's really important to mobilise this area when you're pregnant, to get your breath moving into it as much as you can. So now we're going to bring your feet into parallel, about hip distance apart. So if you think of your hip joints there, you want your knees and your ankles to line up as much as possible. And then come in to start circling your shoulders. And that foot position is really important because the position of your feet has an impact on how your pelvic floor works. So if you're not standing in that parallel position, then you're not giving your pelvic floor the chance to function at its best. And that's what we want, especially when you're pregnant, but actually all of the time, pregnancy, postnatally, and way beyond, and even if you've never had a baby. So really trying to get as much movement as you can around your shoulder blades. Like I said, it's really important that you have got lots of mobility through your rib cage, because that will allow you to breathe better. And your breath is kind of the start of all of your core function. If your breath isn't working properly, then the chances of you getting a really good core activation are much lower. So now you're going to bring your hands to your shoulders and circle your elbows. Finding that movement again in your shoulder blades, feeling a lovely sense of opening across your chest. So depending on where you are in your pregnancy, you might have found that your boobs have got bigger, and sometimes that can really pull us forward. So So we're just trying to open up the chest, get a lovely sense of width across those collarbones. We don't want to get stuck. And keeping mobile and stopping all of your connective tissue from getting stuck can make a really big difference to how everything works throughout your pregnancy. Now we're going to take your feet a little bit wider, keep your knees slightly soft, and then you're going to reach over into a little side bend. Again, I want you to think of sending your breath into the back and the side of your ribs, and then keep that lovely sense of length as you reach back through the centre to go again. Lengthening your spine, inhale into the back and the side of the ribs, and then keep long, and one more time to each side. Use your breath. Find that lovely length through your spine, so you really give your baby loads of space to move, to get themselves into a good position. And then come back to the centre, soften your knees a little bit more, and then we're going to start to circle your pelvis around your legs. So sometimes when we talk about the pelvic floor, it can sound as if it's this kind of isolated muscle that you just lift and squeeze, and that's kind of all that you need to do with it. But the mobility of your pelvic floor is really important, especially when you're pregnant, because you want loads of mobility through the pelvic floor so that you can create space and allow your baby to move through your pelvis and your pelvic floor when you're in labour, if you're going to have a vaginal birth. And your glute muscles, so your bum muscles, feed into your pelvic floor, and we're now just trying to kind of stretch those out a little bit and mobilise within the hip joints, because again, that mobility will really help you to get good pelvic floor function. You can't strengthen a muscle that's really, really tight and stuck. So we want to get as much mobility through the pelvic floor as we can before we move into some more strengthening stuff for that muscle. And now go in the other direction. And I often talk when I'm teaching here about a kind of feeling of twerking. So you're not kind of stuck and sort of moving like this, you're really getting down into it, grounding yourself, which will really help you in labour if you can get that sense of connecting with the ground, connecting with the earth, and then bringing the baby down. And all of these kind of circular motions are really good to do during labour to help work with all of the muscle fibres that circle round as you're bringing the baby down. So now you're going to reach both arms up over your head, clasp your hands, and then push the palms of your hands up slightly. And then we're just going to do a similar kind of action, but this time with the rib cage. So again, we're finding the mobility and getting a lovely sense of movement through the ribs. And then circle the other way. Breathing deeply. And last one. And then bring your arms down by your sides, bring your feet back underneath your hips. And I've just realised I was supposed to turn the comments off, so I'm just going to do that now, so that you can see my feet a little bit better. So again here, we're going to make sure that our feet are really parallel, so the outside edges are lining up. And for some people that can feel a little bit pigeon-toed and like you're kind of turning in. And you might find if you bend your knees from here that your knees roll in a little bit. And I want you to really work to think of turning the thigh bones outwards and moving the thigh bones away from each other, so that again you've got that feeling of hips, knees and ankles all lining up, and that's really going to help your pelvis and your pelvic floor to function better. So we're just going to do a few little knee bends there, just mobilising the hips, the knees, the ankles, but really focusing on your alignment. And if you can ever do this in front of a mirror, it's a good thing to do, because you can then, sometimes what we feel isn't actually what's happening. You know, sometimes you'll feel like you're parallel and then you look down at your feet and realise that you're really not. Now you may want a wall. I'm just going to move over here to demonstrate with a wall or something, just give you a little bit of support. We're going to bend your knees, float your heels up, lower them down, and then stretch your legs. So you bend your knees. Think of, as you lift your heels, keeping your weight through the centre of your foot. So you're not rolling out, you're not rolling in with your ankles. And as you lift your heels, find that lovely sense of lift through your arches. Your feet take a lot of weight when you're pregnant. You know, for most people, you're never going to put on weight at the same rate that you do when you're pregnant. And that quick amount of weight that you're suddenly asking your feet to carry, we need to give them a little bit of TLC and work the muscles of the feet so that they really support you throughout your pregnancy rather than collapsing, which when your feet aren't working well, it has an impact all the way up your body. So we're just going to do 2 more like that. Hopefully you'll start to build a bit of an awareness of your bum muscles working, although don't worry if you don't feel that yet, if you haven't done much movement before. So now we're going to come slightly wider with the feet in a little bit of a turned out position. And I want you to think of the turnout coming from your hip joint. So it's not about getting a really wide feet, it's about rotating out from the hips and getting, again, a lovely sense of support for your pelvis. Again, be conscious of how your pubic bone feels here. So if you get any discomfort around your pubic bone, then you can bring your feet a little bit further in and keep the movement a lot smaller. You're going to inhale to bend your knees and exhale to stretch. So again, play around with how deep feels good for you to go. It should feel really nice and a lovely sense of opening through the hips. But if it doesn't, then make it smaller. Bring your feet a bit closer together. Don't go quite so deep into your bend, or just skip it. Don't ever work through any pain in your pubic bone. It's really not going to serve you in the long term. Inhale as you bend and exhale as you stretch. And that movement, we're releasing the pelvic floor as we come down, and then the pelvic floor is contracting as we lift back up. So it's an unconscious contraction. You don't even need to do anything. And this exercise is a lovely exercise to move your pelvic floor, get your pelvic floor switching on, releasing, and then connecting. So you inhale as you come down, and you exhale as you come up. Breathing in and breathing out. And I want to say good. I usually can at least see people, and my natural instinct is to say well done. So I'm going to say it. Well done. Keep going. Keep that outward spiral through the thigh bones. 2 more. And remember, depending on where you are in your pregnancy, you may have different levels of energy. I really encourage you when you're pregnant to tune into your body. Come out of that now, and we're going to slowly make our way to the floor. So use a bit of support if you need to. But just to give you a bit of a lecture before we do any more movement, that I really encourage you when you're pregnant to tune into your body and to listen to what your body is telling you. So if you're doing exercise and it doesn't feel good, then you don't need to do it. Sometimes we have this mentality of I have to push through, I have to push through. But pregnancy is a real time to tune into yourself and to learn to trust how you feel. If something doesn't feel good, you don't need to do it. And you can take that all the way through to your labour. Trust yourself. Your body knows how to grow this baby. Your body knows how to birth this baby. And whatever you feel is right is a really good thing to listen to. So now we're going to come onto all fours. So you're going to take your knees underneath your hips. Your hands just slightly wider than your shoulders. Find a lovely sense of length through your spine here. And just notice how your sit bones feel, so how your pelvis feels. And I'm going to talk a lot about the sit bones here. So I'm just going to show you where your sit bones are. These are your sit bones. So they're at the base of your pelvis. When you're on all fours, your sit bones are lovely and wide, and you've created a real sense of space and sense of release for the pelvic floor. So you're going to inhale in between your sit bones, find that length through your spine and feel your pelvic floor move down and let go. And then you're going to exhale to draw your sit bones towards each other. Draw your tailbone to your pubic bone to your chest as you round your spine. And then you're going to inhale to lift your tailbone, feel your sit bones widen as you release back into a flat back again. And again, breathing out as you round your spine. Feel how your sit bones draw towards each other. And then as you inhale, feel your sit bones move away from each other and create lots of lovely space. Breathing out as you round, opening up your lower back, and breathing in to release again. And again, exhale as you round your spine, and inhale as you let go. And 2 more. Feel how the position of your pelvis makes a difference to how much space there is. Sorry, my phone just rang. I totally forgot to put it on silent. So you're going to notice the difference between your sit bones when your back is rounded, and notice the difference between your sit bones when you're on all fours. And that's really important to remember during labour. You can keep going if you want to, or I'll just talk about this. But when you're on your back, if you're birthing on your back, it really restricts the amount of space that your baby has to move through. So it stops your sacrum here. Your sacrum can usually move a little bit and lift and create space for the baby to come through. And if you're lying on your back, then you're not able to do that. So just a little labour tip to try and stay as active as you can. If you can avoid being on your back, it's a really good idea to do, because it will make it more difficult for that baby to move through. So now we're going to bring your hands a little bit closer together, and then rotate your spine, and then place that hand back to the floor and twist the other way. And 1 more time to each side, finding that mobility through the rib cage. And then make your way round to sit with your legs crossed. You may want to grab something to sit on, especially if you're a little bit more pregnant. You might want a cushion or a pillow just to give you a little bit of a sense of lift through your pelvis. So wherever you are, you want to feel like you can sit right on top of your sit bones and you're not kind of slumping under, which isn't going to help your pelvic floor function or your baby's position. And your posture has an impact on your baby's position. So it's a really good idea to work on that. Find that lovely sense of length through your spine, and then reach over into a little side bend. Breathe into the side of your rib cage, and then keep that length as you come through the center and reach over the other way. Breathe into that side, and then come back to the center, and then drop your right ear to your shoulder. Close your eyes and breathe. Feel a lovely sense of release through your jaw. So there's an important relationship between your jaw and your pelvis. We really want to try and avoid clenching the jaw and gritting your teeth together. Have a lovely sense of space between your teeth. Allow your tongue to be heavy. And then drop your nose down towards your shoulder and breathe there. And then slowly bring your head back to center and drop your ear the other way. So again, just have that sense of real heaviness through the face, through the jaw. Allow your neck to soften. Breathing deeply into it. And then drop your nose down towards your shoulder and breathe there. And then slowly bring your head back to the centre. Now we're going to make our way down to lie on our side. Now if you've got a cushion or something that you can pop between your legs in a minute to hand, then you can use that. Just going to start lying on your left hand side and just noticing how your body moves as you breathe. So as you inhale, your belly and your rib cage will gently expand and move outwards, and although you may not feel it so easily, your pelvic floor is moving down and releasing. And as you exhale, your pelvic floor is lifting, your belly is drawing in, your rib cage is softening down. So I just want you to take a couple of breaths to notice that and to visualize the movement of your pelvic floor. As you inhale, it releases, and as you exhale, it naturally contracts. Inhale to release the pelvic floor. And then exhale, let it naturally contract. And then towards the end of the exhale, you're going to think of just gently connecting to the pelvic floor, drawing your sit bones, your pubic bone and your tailbone in towards the midline. And then you inhale to let it go again. And exhale, relax first. And then find that gentle connection to the pelvic floor. And then inhale to release. Now, on the next inhale, you're going to think of sending your breath in between your hip bones, so down into your lower belly. And then exhale, relax first, and then draw your hip bones in. Inhale in between your hip bones. Exhale, relax first, and gently draw your hip bones in. So you're engaging your lower abdominal muscles here. You may not feel loads, and that's fine. And then you're going to inhale into the circle at the bottom of your rib cage. Exhale, relax first, and gently draw that circle in. Inhale, so you're imagining that you're breathing in to the base of your ribs, feeling that expansion of the rib cage, and then gently drawing it in. And then try and do all together, so you breathe into your sit bones, hip bones, rib cage. You're using that whole of your torso to create space for the breath. And then exhale, relax first, and then gently connect sit bones, hip bones, rib cage. And if you bring your hand to your belly, you want to feel your belly gently drawing in underneath your fingertips. And then inhale to let that go. Exhale, relax first, and then gently connect sit bones, hip bones and rib cage. And inhale to release. And last one like this, breathing out, relax first, gently connect sit bones, hip bones and rib cage. And inhale to let go. And then if you've got a cushion or something, just bring that, double it up and pop it in between your legs. And then if you haven't got a cushion, you can do this without anything between your legs, just activating your inner thighs and squeezing them gently towards each other. If you've got the cushion, bring it right up towards your pubic bone, and then exhale, connect sit bones, hip bones, rib cage, gently squeeze into that cushion, and then inhale to let it go. So again, here we've got an unconscious contraction of the pelvic floor, because as you breathe out and you activate your inner thigh muscles, that feeds up and connects into your pelvic floor. And then you inhale and you release it, remembering that the release of the pelvic floor is just as important as the contraction. You're going to exhale to gently squeeze and inhale to release. 2 more, breathing out, sit bones, hip bones, rib cage as you squeeze, and then inhale to let that go. And last one like this. And then on your next inhale, you're going to open that knee as wide as you can without your pelvis moving. So have your top hand on your hip, make sure that your pelvis is stable. If you don't have any pelvic girdle pain, then you can move the cushion away. If you've got a bit of niggle in your pubic bone, you may want to skip this one, but having the cushion there just reduces the range of motion, so it can make it a bit easier to do. So you're going to inhale to open the leg and exhale to close it again. Inhale to spiral the thigh bone out, and exhale to gently connect sit bones, hip bones, rib cage. Inhale as you open the leg, and exhale to close. And you'll feel as you inhale your pelvic floor releases, and as you exhale it contracts. So again, we're using that unconscious contraction of the pelvic floor. Inhale as you open, and exhale as you close. Any discomfort in your pubic bone, any discomfort in your back, then don't do this one. You may be fine to do it with a teacher on a more individual basis, but when you're not working with anyone in person or through Zoom and not getting that real feedback, you really need to make sure you're not doing anything that aggravates things. Inhale as you open. So hopefully you're starting to get a bit of a burn in your bum muscles now. Ideally that top bum cheek is starting to work, and that's what we want. We want to get those glutes to fire and switch on, like I mentioned earlier. 2 more. Inhale as you open, exhale as you close, and then make this one your last one. Inhale to open and exhale to close. Good, well done. So now we're going to come onto the other side. If you were using a cushion, then grab your cushion again. We're going to go straight into the contractions now that hopefully that makes a bit of sense in terms of your breathing. However, please don't panic if you feel like it's a bit confusing with the breath. It is confusing to start with, but keep practicing it. Keep coming back and doing this video again, because the more you understand the movement of your pelvic floor, the better. And I get so much feedback from people who do my classes saying how much it really helped them during labour to have that connection into their body. So you're going to inhale here and exhale, relax first, and then gently squeeze into your cushion, or just gently think of drawing your inner thighs towards each other, and then inhale to release. And again, breathing out, relax first, gently connect, gently squeeze, and inhale to release. And again, breathing out and breathing in to let go. And 2 more. Feel that connection into your pelvic floor, and then you're going to inhale to spiral the leg out. Take your cushion away if you're comfortable with that, and exhale to close again. Inhale as you open, and exhale to close. Find the outward spiral, so don't just think of the knee, think of the hip joint, and finding that mobility and that movement through the hip. So you're strengthening your glutes here, but you want to do it in a way that you really create space there at the same time. So you're not making everything really kind of stuck and short and tight. You're reaching the thigh bone away from you, giving you lovely, long, lengthened, strong muscles rather than short and stuck and tight ones. Inhale as you open, and exhale as you close. Inhale, spiral the thigh bone out, and exhale to close it again. And again, just bring your hand to your top hip. Make sure that your pelvis doesn't shift, and especially when you're pregnant, you really don't need to go to your absolute maximum position here. Finding just a place where you get the burn but you're not kind of forcing the leg out is usually a lot more effective. So 2 more, nearly there. Hopefully it's burning a little bit. You can squeeze your top heel down to get a little bit more burn. And if you don't feel any burn, it may be that your glutes are just not quite firing yet. And do feel free to get in touch if you've got any questions about how you might be able to do it more effectively. So now we're just going to make our way up to standing and finish with a few squats. Squats are one of the best exercises that you can do in pregnancy and postnatally, because they really work your pelvic floor in a really safe and gentle way, but also because they're so functional. When you're looking after a baby, it's a physical job, and you need to get yourself prepared for that while you're pregnant. So again, you're going to find that alignment. Make sure that the outside edges of your feet are lining up. Think of that lovely spiral through your thigh bones, and then you're going to make sure you're hinging at the hip. So you inhale as you sit down, let your tailbone lift, and think of your knees stacking over your ankles as much as you can, and then exhale to push up again. So you inhale as you bend down, and exhale to push up. Inhale as you bend down, and exhale to push up again. Think of that outward spiral. Don't let your feet move. Keep that parallel position, and make sure you're finding that lovely hinge at your hip joint. So what you don't want is to be kind of coming down like this and not feeling that release of the tailbone. You may notice that I'm a little bit obsessed with releasing the tailbone, because it will really help with your pelvic floor function, and it will really help you during labour too. And I'm just here out of habit doing that release of the pelvic floor, and then it will contract again. So you breathe in to release and breathe out to contract. So again, it's coming back to that unconscious contraction of the pelvic floor. Kegels, that kind of lift and squeeze that often the midwives might be talking you through, they're a great exercise to do to a point, and they do have their place, but they're just a small part of getting really good pelvic floor function. And when you're pregnant, the release is just as important as the contraction. In fact, it always is actually, but especially when you're trying to prepare for your birth. So last one, inhale as you bend and exhale as you stretch. Okay, thank you for joining me. I hope you enjoyed that. Do feel free to get in touch with any questions. So I'm Grace Lillywhite, and you can find me at Centred Mums Pilates. Thanks for joining me.